So the next case, Purvi, is a 62-year-old gentleman that I saw around a year and a half ago. And he's a patient presenting with right eye cataract. He's had previous myopic LASIK. He was around -6.5 to -7 diopters pre-LASIK, so quite a high treatment. His left eye was targeted for distance vision and his right eye more for near vision. So he had a blended or monovision setup when he had his LASIK, which he actually adapted to really well. He told me that he had around a -1.5 difference between the two eyes after LASIK. So he wants more spectacle independence. He only wants his right eye operating at the moment. And the question is how we approach this and what type of lens we use. So when we're looking at his vision, you can see that it is reduced. He's myopic in that eye, so he's had some degree of regression over the years, or he's developed myopia due to the cataract, as it's probably a combination of the two. His best corrected vision in the right eye is 618, and with a 2.5 add, he's N10. In his left eye, he's seeing 6.5 with best corrected vision, so he doesn't want that eye touching just yet because his vision in that eye is pretty good.
Of course, with the modern day biometry, obviously you do have functionality where you can input that the patient's had previous LASIK, whether it's been for hyperopia or myopia, and it will give you a lens based on that. We also tend to use the ASCRS calculator, whereby you input as much information as you can, so pre-op CILs, pre-op Ks, and pre-op refraction, and the immediate post-op refraction, plus the latest biometry, the today reading of biometry, and it gives you a selection of lenses to use. Now, this patient had some astigmatism on the biometry in that right eye, so we then had to input that spherical equivalent that we were after into the RayOne IOL calculator to come up with the toric lens that you needed.
So once you know the spherical equivalent that you want, you have to input that into the calculator.
Exactly.
So you will have to fudge your refraction essentially to get the spherical equivalent that you want.
You do. It does have a functionality where you can just manually input the SC that you require and you add it in. It will do the calculation based on the SC that you have inputted, and you ignore what the post-op would be because you know that that's the spherical equivalent that you require.
Perfect. And for this patient, I decided to implant for the right eye a RayOne Toric lens, and we're aiming -1.5 like the patient had after the laser vision correction. So we implanted a RayOne Toric into the right eye, targeting -1.5, and I'm going to present the outcome of both eyes because about 6 to 8 months later, he contacted me saying that his left eye had now deteriorated and he wanted the left eye doing. So I'm going to show you the results for both eyes. And with the left eye, we did target plano. So with the right eye, he ended up 0.34 unaided, which we would expect with a -1.5 refraction, but he had excellent near vision of N4 in the right eye, which he was very happy with, and N5 for intermediate binocularly, which was brilliant. In his left eye, which was targeted for plano with a RayOne monofocal lens, he achieved -0.12 or 6.5 vision in the left eye. And he had an excellent refractive outcome and visual outcome, and he was really happy with the results. I think it goes to show as well in patients who've had LASIK before, who have those natural aberrations in their cornea, they're able to get a nice range of vision. You know, we targeted -1.5, but we got N4, which is brilliant. And it just goes to show you don't necessarily need to use advanced optic lenses for these patients to have really good outcomes.
I think, Masara, you look quite closely at the pentacams, don't you, on this patient, just to have a look at the aberrations on the cornea to see if they're going to have depth of focus and what kind of near vision they will end up with. You can see here how that's paid off just by looking really closely at those scans.
Yeah, definitely.